In this talk, I will discuss the first stage of the project that we're working on, which involves developing a pregnancy planning guide for women at risk of postpartum psychosis. I will mainly be discussing the results from the Stage 1 qualitative interviews that informed the guide, which were conducted with women with lived experience of bipolar and postpartum psychosis, and also clinicians and healthcare professionals. For this talk, I'll briefly introduce the project and discuss the method before going on to discuss the results, focusing on the more debated topics that came up during the interviews. And then I'll finish the talk by explaining what the next steps for this project are. Qualitative research has shown that women with bipolar find it difficult to find the information they need when making decisions during the perinatal period. Dr. Claire Dolman's recent research on women with bipolar and pregnancy decision-making has set the foundations for this project. As you can see from the quotes here, women suggested that a guide or a booklet could be useful to work through during this time. And professionals also saw the benefit of a guide to facilitate discussion with professionals and family members. There have been a number of studies looking into the use of a decision aid during the perinatal period, including Vigo and colleagues' recent work trialling an online patient decision aid for women deciding about antidepressant use in pregnancy. However, to my knowledge, there have been no studies looking into the use of a guide that includes information on a range of topics for women at risk of postpartum psychosis when planning a pregnancy. There are numerous useful and evidence-based resources that are available to women at risk of postpartum psychosis, as shown here. However, currently there is no guide or decision aid available for these women to use and personalise during the perinatal period. And following on from previous qualitative work, this current project aims to work collaboratively with women with lived experience of bipolar and postpartum psychosis and healthcare professionals to develop a guide to help women plan for the perinatal period. A key factor in this project is that we are working collaboratively with Action on Postpartum Psychosis, women who are experts by experience and help other women throughout their pregnancies. This collaboration will be an essential part of each stage of the project. The main objectives of the project are to determine what the critical components of the guide are, to see whether the guide is acceptable to women, and to see whether it will be feasible for us to carry out a larger scale study in the future. But for this talk, I will focus on the first objective, which relates to the first stage of this project. This project to develop and test a guide will follow Medical Research Council guidance, which includes firstly developing a prototype of the guide and then pilot testing and refining it based on feedback. To inform the development of the guide, we have received advice and suggestions from an advisory group of women from Action on Postpartum Psychosis. We have carried out an extensive review of existing resources and research, and also conducted qualitative interviews with women who have lived experience of bipolar or postpartum psychosis, as well as clinicians, healthcare professionals and researchers. The qualitative interviews were transcribed and analysed using a process of inductive thematic analysis. Analysis of the qualitative interviews identified the following main themes. I'll briefly introduce each theme and then provide examples of how the discussion in the top three translated into informing the guide. Knowledge is power. Women felt that having somewhere where they could access the information needed when making decisions would be empowering. Even if some of this information was daunting or scary to read, it was better to know. This theme came with the caveat of not overwhelming women with too much information. which leads me on to the next theme of simplicity. Many women and professionals saw the benefit of including simple initial information in the guide and suggested signposting to reliable resources or healthcare professionals for more detailed information. Women and professionals also suggested a simple presentation for the guide, for example, presenting some information visually without including too many statistics and figures. Stigma. Women and professionals advised covering certain topics with care or not covering some topics at all due to stigma. Some women were also hesitant to include diagnoses on the front cover, which I'll discuss in the next slides. Using the guide with others. Almost all women and professionals felt it would be useful to use the guide with others, for example, as a way to educate significant others, to plan and prepare with others if they did become unwell, and also to use as a tool to prepare for or use during appointments. Choice is important. Many discussed how everyone is different and may want to use the guide in different ways. For example, not everyone would want to personalise the guide, and some women may choose not to use the guide with others. Hope and reassurance. It was felt that the guide should have a hopeful and reassuring tone. For example, for women to know that pregnancy is possible, and if they were to become unwell, providing hope for recovery. One of the suggestions that came up during the interviews was to include real-life stories from women who have been there themselves and have recovered, and having a focus on how to reduce risk and the support that's available. In terms of the use of labels, some women said that it wouldn't be their preference to have diagnoses on the front, particularly if it was something that they were reading in public or maybe leaving around the house. However, most women and professionals felt it would be helpful to have the diagnoses on the front somewhere so that women would know whether to pick it up or not. Suggestions included having diagnoses on the front, but in smaller writing. This came within the theme stigma and also touched on the theme of simplicity. Some women said that while it could be scary to hear about individualised risk of becoming unwell, they mainly felt it was important for women to know this to inform their plans and decision making. This came within the theme knowledge is power. When it came to including information about the chance of their child going on to develop bipolar, some women stated that this wouldn't be a priority for the guide, but may be useful to include somewhere briefly. One woman explained that it was important for women to have the facts and that the guide didn't skirt over information like this. Women also questioned whether this was the best time to provide women with the information, particularly if a woman who was currently pregnant was using the guide. This came within the theme knowledge is power and also touched on the theme of simplicity. Again, this was a topic that received mixed responses, but women and professionals mostly felt that including information about parenting specifically for women with a diagnosis of bipolar could appear to be stigmatising. Some suggested that this information should be the same for everyone, regardless of diagnosis. One woman suggested that including information beyond the postpartum period to discuss parenting more long-term would be ambitious for a guide like this. This came within the theme stigma. To update on where we are now with the project, we have developed the initial prototype of the guide, and this has now been sent out to women who are either planning a pregnancy or are currently pregnant, and they will test it out as part of the first pilot study in stage 2. This testing phase will be followed by feedback interviews with the women. This will be a great opportunity for us to ask about these more controversial topics discussed. and this feedback will have important implications in informing refinements made to the guide for the second prototype, which will then be tested during the second pilot study. We hope this study provides an opportunity to make a difference to clinical practice and prevent or mitigate the adverse consequences of perinatal illness. And finally, I'd like to thank everyone mentioned here who have helped with the project so far, and I'd particularly like to thank everyone from the Action on Postpartum Psychosis Advisory Group and all of the women who took part in the interviews. Thank you for listening.